Hey everyone, welcome to OET 369. Today we are back with another roleplay card.
Today's roleplay card is specifically requested and it was part of the recent exam, and it's about an elderly patient and her communication with the nurse. The patient is quite nervous in going back home because she had sustained a serious injury to her hip, and the nurse's duty is to reassure this patient and ensure she's feeling comfortable enough to go back home.
In this roleplay card, as Donna said, we are going to deal with an elderly patient. So there are certain things that you may have to consider when you communicate to an elderly patient. The first and foremost thing is try and avoid complicated medical terms. They may not be able to follow the complicated medical terms that you guys say. So try and avoid that. Just try and explain it in the simple language. And the next thing I would like to highlight is avoid jargons while you speak. Speak clearly and logically so that an elderly person can catch your ideas quickly. And the next thing I would like to highlight is when you communicate to an elderly patient, make sure that you tell them they are supported always. It's quite common for the elderly patients to feel that they're on their own, there is nobody around to support them, and that's why they feel quite lonely, and that's why they're declining to go home. So understand this aspect of their age, and probably respect them by saying, actually we have got quite a lot of support around you, we've got so and so people to help you with us, we've got nurses and doctors to look after you even after the discharge. I think basically you need to reassure them saying that you're not on your own, you're not alone, we're all here to support you. And with that support, they'll be quite confident, and they'll be able to think that actually I am fine to go home. And this is what you need to implement. I guess we can start now, shall we?
Yeah. Yes.
Good morning, my name is Asha. I'm one of the nurses looking after you today. I hope the surgeon has seen you just now, and we're glad to say that you can go home tomorrow.
I don't think I'm ready to go home because the injury is quite big. I'm not sure if I can do that.
Well, the surgeon has seen your injury and he thinks that medically you are quite fine and you wouldn't need to stay in the hospital for any medical reasons. May I know what is that exactly you're concerned about going home?
I'm concerned about moving around, and I'm just scared I'm going to fall in the shower and just going to re-injure myself.
Okay, I think that's quite reasonable concern because especially after the surgery, most of the patients have the same thinking, and they think that they will not be able to cope as usual, which is quite understandable. But let me reassure you, we had a chat with your family and your friends, and they have agreed to support you once you've got discharged home. So I had a chat with your family members, and they say that they're happy to support you if you need. But we are also sending a frame just in case in the initial days when you get up from the bed, you may just need a little bit of help with the frame. But that will only be like 3 or 4 days. And if you're going for showering, one of your family members agreed to keep an eye on you just to make sure that you're fine. So that should all be fine, okay?
But how will I get my medication and things I need, like pain relief?
Well, yes, you have got some medications to take home when you get discharged. Well, we have already had a chat with your pharmacist who does all your other medications. So the pharmacist has agreed to supply that medications with your usual medications. So you will be getting that in 2 weeks supply of medications at your home. And the good thing is that you don't even have to go to the pharmacy. They are going to do a door delivery for you because now you've got the injury. So I think you need to be taken care without going outside. So they'll deliver that to your home. Okay?
Because it's a big wound on my hip, I don't know how to clean it, how to make sure it doesn't get infected or...
Well, yes, that is another thing I would like to chat to you about today actually, because in the hospital we were dressing the wound and we were looking after you, but obviously at home what you need to do is you just need to make sure that your wound doesn't get any wet or any sort of infection, any sort of dust or anything like that. And the other thing you could do, you have to do is you have to make an appointment in your GP surgery, and they will actually make sure that your appointment is booked like in the specific intervals. So they'll follow up with your wound care and stuff. So the nurses in the surgery will assist you with the dressings and stuff. You wouldn't need daily dressings from today. You only have to probably get dressings like 3 or 5 days, which your GP surgery will organize for you. So that should be fine for you. Okay?
Okay. How long will it take to heal? And how long do I have to take the medication for?
Well, the healing time depends on the patients, unfortunately, and I can't say any specific time. But usually the healing time takes like 6 to 10 weeks, and we actually will arrange a physiotherapy appointment as well. So they'll teach you some exercises and sort of small exercises, so you can get your muscles regained. Your muscles can get regained strength and all, and we'll make sure that the physiotherapist will have an exercise protocol. So it will be like simple exercise like you twisting your fingers and all sort of things. So that should actually enable you to regain your mobility. And so the healing time depends on how much you follow this exercise, how compliant you are. And the other thing is you have to take your medications on time, and in the usual case it's 6 to 10 weeks. And we'll make sure that the GP will get in touch with the GP surgery, and they look after you till your wound is healed. So don't have to worry anything about going home. Everything is organized. You'll have the pharmacist, you'll have the physiotherapy, and you'll have the GP surgery supporting you even after the discharge. And do you think you're ready now?
I think I do. I think I'm a bit more readier now.
Okay. So I'll get you all the paperwork, and you'll also have a discharge summary to take home with you. So you may have to get that to the GP surgery. We'll actually send a small exercise regime for you, so you can have a look till your physiotherapist come home. The pharmacist will deliver your medications as well, as I said. Okay? So everything is in place, and I will get in touch with you as soon as everything is ready. All right?
Yeah.
Okay. So thank you, Donna, and I hope you have a faster recovery.
Thank you.
Bye-bye.
Bye.
So that was a role play card for an elderly patient who was really nervous to go home after the surgery, and the nurse's job was to convince this patient. I think as long as the nurses communicate effectively to the patient and the support services required, if the nurses can explain that, I believe that is the main thing that they should be looking to. So if you guys can do that in your exams, I think you should be fine. Thank you so much for your support. Keep on watching OET 369. We'll be back with another role play card soon. If you would like to have any specific role play card queries, you can email me at oet369@gmail.com. For any online course details, you can either WhatsApp me. I have included with the WhatsApp number with the description, or you can log on to website english369.uk. Thank you so much for your support. Keep on supporting us. Thank you. Bye-bye.